Smallpox. A simple DNA virus that has had a huge impact on human history. A quick spreading pathogen with lethal and well-known symptoms. Yet it was eradicated decades ago by global efforts. Smallpox, also known as the variola virus, is known for its distinctive skin lesions and rashes left on the skin, mostly the arms and legs, but can also be found in the mouth. The term was coined in 16th century England to differentiate itself from syphilis, which was known as the Great Pox. The term pox is used to describe a disease that leaves pockmarks or skin lesions. In recent history, we have seen diseases related to smallpox, such as monkeypox and molluscum contagiosum. The monkeypox outbreak of 2022, though milder, reminded us of smallpox's impact. Molluscum contagiosum, which causes small lesions, remains common today. Smallpox has been with humanity for millennia, likely originating in Egypt or India and spreading via trade routes. Despite its ancient roots, the exact origin remains unknown. Smallpox spreads through direct contact with an infected person or contaminated surfaces, where it can survive up to 17 weeks at room temperature. The smallpox vaccine was one of the first ever vaccines developed in history, and it used tissue from cowpox to be able to grant the users antibodies from cowpox, which thus gave them immunity to smallpox as well. Now, cowpox was a lot less lethal than smallpox, so this was a very good choice for the doctors and everyone else. Diagnosing smallpox involves identifying antibodies in blood from lesions and using polymerase chain reactions, PCRs, to detect the virus. Symptoms appear after an incubation period of 7 to 17 days and include malaise, fever, severe headache, skin lesions, and diarrhea. Vulnerable populations include the elderly, immunocompromised, pregnant women, unvaccinated individuals, and young children. There is no cure for smallpox, so treatment focuses on supportive care, which includes hydration, pain and fever management, isolation, IV fluids, wound care, and antivirals. Social distancing and hygiene measures are vital in preventing smallpox spread, given its high reproduction number of 5 to 7. Travel restrictions and banning public gatherings can significantly reduce transmission rates, helping to flatten the infection curve and prevent overwhelming healthcare systems. Smallpox was eradicated in 1980, with the last case reported in Somalia in 1977. Donald Henderson, who led the WHO's eradication program, estimated that smallpox killed 300 million people in the 20th century alone and affected at least 500 million. The true numbers throughout history are likely much higher. Smallpox has left a huge mark on human history, showing us the devastating potential of infectious diseases, as well as showing us the importance of vaccination and public health. Understanding smallpox's history helps us appreciate the strides made to combat infectious diseases, as well as the progress of modern medicine.